everybody, it's feeding time at the farm, and we all know the most important part to being able to eat is having good teeth. When your teeth are that big, yes, that is one tooth, and you can see how the root is down here just like our teeth, and the flat surface here, because they are not meat eaters, they don't have pointy teeth, they have flat teeth. And the older the horses get, the more they wear down that tooth surface. And that's not going to grow back. Once they have worn down that tooth surface, it makes it harder and harder for them to eat. Now, Jojo here, his teeth don't line up. So instead of being able to chew like this, he's missing teeth. So his food is not able to be fully chewed and digest. And that's what's happened, why he has lost so much weight, is because he was not able to digest his food. How we compensate for that here, because of course we are not giving him implants, but instead what we do is we water down his food. We soak it all down. So by the time he eats it, and he makes a mess, by the time he eats it, it's already half digesting. It's already chewed. That way when it gets to his stomach, his body can metabolize it and he can put some weight on. So we do have to feed him senior feed and soak down his alfalfa pellets. So what about all of our other animals? Well, all of our animals need tooth care. So we check on their teeth. For us to be able to have the dentist come see them, it's actually the vet, and sometimes some farriers will be able to do the dental work too. But they need to be able to get their hand all inside there. That's more of a job that I want to do. I'm not willing to do that. But she'll get her hand in there, she'll check on their teeth, she'll grind them down, make it level, because if you have too much wear on this side and not much wear on that side, they'll get a sharp edge on there. And you know how when you chew, especially if you had braces, how something poking kind of ruins your whole day and makes everything hard to eat. Well, she'll get in there with a file and grind that down so it is smooth all the way across and no sharp edge on there. Sometimes she has to pull a tooth out, and just like us, she takes giant pliers, she wiggles that tooth around and she pulls it out. And you know, when you have a toothache, it makes everything hurt. Your head hurts, you don't want to eat, it makes everything feel horrible. Can you imagine being 1,200 pounds and having a toothache? How much that's going to affect your whole body? So horses should be seen, have looked in their mouth, like every 6 months. And the older they get, of course, more often they need their teeth looked at. Nugget, he has a severe underbite from his dwarfism, from being inbred. So his underbite makes him form a whole lot of plaque on his teeth. So his chewing, he's not getting that food off of there, and I'm not getting in there with a toothbrush in there to get it out. So what the vet has to do is scrape his teeth. So just like when we would go in for an annual tooth cleaning, he has to have it quite a bit more often, and she gets there and picks all that plaque out for him. That way, his whole body is healthier. You need healthy gums to be able to feel well. You need to be able to eat, and all of that takes a lot of extra dental care. Now, typically the cost is about $150 a treatment per horse. So, significantly less than when we go to the dentist and get that kind of care done. But it really means a lot to their health and well-being to be able to have their teeth done. So I hope you enjoy the rest of the video where you can actually see how our Dr. Gina takes care of their teeth. Thank you.
Yeah. And she's got quite a few teeth that are pretty well worn down, but can at least smooth out what she has and hopefully make it more comfortable for her to chew. Easy, good girl, Julie.
Yeah, that's because she's been chewing on grass.
What's that?
This is the float, which is basically a Dremel to wear down the sharp edges of her teeth. I'm gonna end up giving her a little bit more juice.
I don't think she's gonna stay still.
She's a little bit sedated, but just because she's older, start with a really light dose, and we can always top her off if we need to. Good girl. Okay. Girl. Here she had those sharp points going into her gums. On this side especially, we've got a lot of teeth that are easy. Good girl, worn down. Need to get a brighter flashlight too. On the bottom here you can see where these are just basically worn down but smoothed out that wave mouth. And all these sharp points that we're sticking in. Girl. So this really aren't too sensitive.
Don't bite your tongue.
There's actually a tail down, none of those are sharp. Nothing's loose. Okay, oh, I know. Wish they made like miniature whole mouth speculums, but just with this bite, I don't think there's. Is that even gonna be too big?
It might.
Let's go. Oh, little man, I know. Oh gosh, those canines are huge. Yeah, we could do like that to get the incisors and then kind of pivot to get the back of the mouth. Good boy.
I know. You want to close your mouth.
It's okay. Good boy. Should I get some of the black off of those too? Good boy.
Like a third on.
I know. Yeah, he's got to be at least late 20s looking at his.
There's not much room.
But I might try it with.
Sorry for such a challenge.
Oh, it's okay. It's not his fault that he's little. I might just try it without that and see how far back I can get. I'll get some of the clock off too. Oh my god. Back on that side. There we go, good boy.